Thank you. Thank you, Premier Alan Winde. Let me take this opportunity to extend my greetings to you and to your MECs, and also to the ministers who have accompanied me on this visit. I'd also like to extend my greetings to the religious leaders who have graced this occasion and thank them dearly for offering the prayers and the intercessions with the Almighty God for this most important occasion, and we want to thank them for continuing to intercede on behalf of our nation, our people, with our Almighty Being, to enable us to navigate our way around this pandemic. Their continued prayers and presence amongst us is not only a strengthening moment or effort, it is also enabling us to be able to handle this pandemic with determination, and so we thank them, and all of them. I'd like to thank you, Premier, for your leadership. Your leadership has been quite forthright. We've seen how you've, with great determination, been leading our fight against COVID-19 in this province. So we thank you for that. And let me also thank the officials who have been working fervently, from all the health workers who we thank, and many of them have been making sacrifices, life sacrifices. We've lost a number of our health workers in this fight against COVID-19, and they are putting their lives on the line in order to save our lives. And we continue to thank them, and we want to strengthen them and make sure that they are strong enough to continue this fight. I'd like to thank our police as well as our soldiers who are enabling us to manage this pandemic. And of course, we have to thank the media. They have been devoting a great deal of time and effort in spreading information about all the work that is being done in this fight. I'm rather glad that we've got national cabinet ministers who have come down on with this visit. Minister of Police, because Minister Cele has a lot on his hands together with his commissioner here. This is a part of the country where the police have had enormous challenges, and we're glad that he can be here, and he visits this province on an ongoing basis as he does his work. But we're rather glad that he's also here, and the Minister of Public Works and Infrastructure, Minister Delil, also has her job cut out, because we need to be setting up hospitals, field hospitals, and she needs to, and she is giving a lot of support in all this. Minister of Water and Sanitation, Minister Sisulu, I'm glad to hear that water is being made available on an ongoing basis, and that is pleasing. And Minister Creasy, Environmental Affairs, is here, and Western Cape is an area where environmental matters, particularly along our coastline, also is important in the fishing industry. So that is also key. Minister of Transport here in the Western Cape, particularly train transportation, is a major challenge, and I'm glad that Minister Mbalula is here. Other ministers were supposed to be here, but they are also engaged with other matters. Minister of Defense and Military Veterans was meant to be here, as well as Minister of Basic Education. We're rather pleased to have this opportunity to receive this report, and I'd like to congratulate you for presenting such a thorough and well-prepared presentation that has given us a very broad introspective look at what we are doing here in the Western Cape. The Western Cape is the epicenter of COVID-19 infections, and this concerns us deeply as the leadership of the country. And it is for this reason that we felt it necessary to come here, because we need to address this, and I'm glad that your presentation has identified a number of interventions that you've embarked upon. And I'm also glad that Minister of Health, Dr. Mkhize, has spent quite a lot of time here and has been interacting with you on an ongoing basis, and as recently as a few days ago. And we are pleased that Minister Mkhize and his department and all those that he works with are going to remain focused on what needs to be done in this province. Minister Mkhize's work is quite intensive and broad, and he has to be in all places at one go. And as you correctly say, he is our minister who is virtually in Geneva, but has to be in all parts of the country. And we want to thank him for continuing to lead the charge on behalf of our nation, and also focus here in the Western Cape. I'm also pleased to see that at the provincial level, the government is working extremely well. You continue to meet regularly. That is very, very pleasing. But I'm also pleased to hear that and to see that you're cooperating well even at national level. There have been suggestions that the Western Cape has always wanted to excise itself outside the broader realm of national government interventions, but you've demonstrated that you are dynamically linked, because the Western Cape is part and parcel of South Africa. We are a unitary state, and Western Cape cannot be seen to be charting their own path. And as we face COVID-19, it is very important that that cooperation is at a deep level with the Ministry of Health, as well as all other departments in our government. And Premier Windy, I'm really pleased that under your leadership, you are ensuring that that cooperation is effective and carries on at a very deep level. I, for myself, I know that we work extremely well together, you and I, and I'm rather glad that the Western Cape can continue doing precisely that. And you at the Western Cape, you've been a leading province in strengthening the district development model, and it is through the district development model that we will be able to have a much more effective management of COVID-19. And if we strengthen that level of working, we will be able to ensure that what we do is most effective and does not lead government to areas of weakness. COVID-19 has also given us an opportunity, which is clearly demonstrated here in the Western Cape, to work with other role players, to work with NGOs, to work with religious, faith-based organizations, and to work with all manner of other entities that have an interest in ensuring that we address COVID-19 properly. I'm glad to hear from your presentation that that is something that you have embraced, and indeed we need to be working together with key role players in our society in everything that we have to do. I have received your letter, and your letter sets out the key challenges that you are facing here in the Western Cape, particularly when it comes to staffing challenges as well as the funding. Let me immediately say, as Dr. Mkhize has said, the staffing challenges must be solved. We are at war. We are fighting a life and death war, and staffing challenges must be solved. We must identify, headhunt, and find all those staff members that we need to bring in. Cost is not the issue here. Saving lives is the main issue. And that must also apply here in the Western Cape. When I went to the Eastern Cape, they were running short of a number of health workers they needed to bring on board. We immediately said, together with Dr. Mkhize, that they must go out and find those health workers so that we can manage COVID-19 properly. And similarly, I will say here, not having enough staff members is not going to be an excuse that I will accept. We've got to find them. Money is not going to be the issue. We must pull out all stops to save lives. This is a war that we must win. We cannot sit back and be defeated by COVID-19 on the basis that we didn't have enough staff members. Department of Defense and Military Veterans, Dr. Gulube is here, who is the Secretary of Defense. They are on the ready to bring in defense military personnel who will be able to come to this province immediately to come and lend a hand. And we must also find staff members in various other provinces, and Minister Mkhize will make sure that they are identified and they are brought here. You've alluded to the fact that one of the challenges that you're going to face is beds. Now, I've heard your account in your presentation about the number of beds. I still think that faced with the challenge that we have of greater infections, up to 66 infections in the Western Cape, and having had 77% of the deaths in the country, you will need, and you do need, more beds. We must increase the number of beds. I'm not satisfied with and happy with the limit that you think that you're going to have. We must increase the beds. It's better to over-provide rather than to under-provide, because the worst is still and is yet to come. We therefore must increase the number of beds. This is the one issue that I am not particularly happy with. I would like to see a margin above what you are providing for, so that we are constantly on the ready. When I went to KZN, they had also under-provided the beds that they were going to make available, and at that point we said they need to increase those beds, and they have responded positively, and the beds are now going to be increased. It's all very well to work with models. Models will tell us this and that, and they all work on the basis of probabilities. And I think in terms of our governmental management of this pandemic, we must always be ahead of the curve, over-provide, because if we don't do that, when we have a rush or an increase of people who need beds, we should never be found wanting. In this case, because we are at war, we should never be found wanting. let us make sure that we pull out all stops and we provide more beds than we may need on the basis of the models that have been built by a variety of people. I'm pleased with the way you are approaching the differentiated strategy where we have identified hotspots. Premier, you earlier told me that the focus that the hotspot strategy that we outlined is now being used for, and a place like Witzenberg is already showing great results. I'm very pleased with that, and I'm pleased that Minister Mkhize had an opportunity to look at that as well. This is precisely what we want to see in all the hotspots, where our interventions and our solutions are focused on each of the hotspots, because it already shows, going by the Witzenberg case, that our hotspot strategy is the correct one, and let us intensify it and begin to apply it in many other areas that are hotspots. Because our task is to continue flattening the curve, and flattening the curve is not a one-day event. It is an ongoing process. It is flattening this curve. We're not going to be able to eliminate this pandemic at one go. It is going to be and stay with us for quite a long time to come. We therefore need to identify areas where there are hotspots, focus on those, and use all the tools that we've got in our toolbox. One of the issues that I did not hear very clearly being articulated here is contact tracing, because it is when we upscale our contact tracing that we will be able to follow through all those who are infected and the contacts, and isolate them, quarantine them, and make sure that we are able to flatten the curve on an ongoing basis. And of course, testing has to be upscaled. I know that you've got a backlog of, say, 27,000, but we've got to upscale it. And as Minister Mkhize was saying, we're now going to be able to procure testing kits through this platform that we are launching in a few days for the entire continent, where we will have up to 30 million, well, 60 million for starters, test kits for the entire continent, and where we will have those 30 million test kits being made available every month. And this is a platform that's going to enable our own manufacturers here in South Africa being part of the platform, and a number of other countries on the continent, as well as the offshore ones, be it China, be it Russia, and so forth. We will all be able to buy through this platform. So soon our challenges when it comes to testing kits is going to be resolved in no time, and we should then be able to continue with our testing. But it's important that the screening campaign that you were showcasing here should continue, particularly through the community health workers who should be spread throughout the province, in the townships, in the various places. They should be spread throughout. One of the ways in which the infections have been spreading also here in the province has been through lack of sufficient social distancing. And as has been reported to me, it's been in shopping centers, in malls, and so forth. We now need to embark, and your presentation raised it, on a massive communication campaign, so that the level of awareness amongst our people should be raised exponentially, so that they become more and more aware of the need for social distancing, wearing of masks, cleaning of hands, and all the protocols that need to be put in place. The same thing should obtain in workplaces, particularly in the farming areas, that needs to be embarked upon. Lastly, you have in your letter alluded to the fact that funding is needed. Yes, funding is needed. We have said that we are going to allocate 20 billion rand to COVID-19, and that is going to work itself through the various budgetary reprioritization processes, but also obtaining the necessary funding from a number of sources. So funding should never be a problem. If it is a problem, it is a momentary problem. We have decided that COVID-19 is a war that we need to fight and win, and therefore we are going to allocate the resources that are necessary. And we note that you need up to 3 billion or so. Funding will be made available because you are the epicenter of this pandemic here in the Western Cape. So that will be addressed, and I'd like to see that addressed in the bringing in of more staff, putting in place more beds, tightening up on our hot spot strategy, making sure that we implement it to the full so that we get exactly the same results that we are getting at Witzenberg. But all in all, Premier, if we focus on all those areas that, yes, you have identified in your strategy, what Minister Mkhize has also alluded to, and the areas of more beds, more staff that I have raised here, and ensuring that communication is spread as effectively as possible, I am sure we will be able to address this. Now, the last part that I'd like to deal with is obviously at the social level. A number of our people are distressed. There's shortage of food. Many people will have lost their jobs. We do need, at all levels, to come up with an economic response. It does not only rest with the national government, the provincial government must also come up with clear strategies of how we are going to support the various places of employment, companies, to ensure that people do not lose their jobs. But at the social level, we do need to take care of those of our citizens who are facing great difficulties at the social level, where there is hunger, and we need to ensure that it happens at the community level, and we are responsive to the needs of our people at community level. And as we distribute food, and I'm glad to see that you've been focusing on distributing food parcels, but also the meals, as we do so right across the board, and we don't politicize the distribution of food, and we make sure that there is no corruption. We do it on the basis of addressing the needs of our people. That is critically important, because that is what needs to be driving precisely how we respond to COVID-19. So I look forward to the further work that needs to be done here. And I'm glad that Minister Mkhize will be spending more and more time coming here. And if there's a need, I'm willing and prepared to come back to see the way you will have moved forward to implement this. I want to see the success of Witzenberg being replicated in Khayelitsha and Overberg and a whole number of other places, so that we come on top of COVID-19 and we flatten this curve. The curve must be flattened. The whole country is focusing on what's happening here in the Western Cape so that they can learn, but at the same time, we need to demonstrate that we can flatten the curve. And it is in our collective hands, all of us as citizens of our country, but also as leaders in government, as officials, we need to be doing precisely that. And with that, I want to thank you for the presentation and also for showcasing exactly what you are doing. And thank you for the work that continues to be done. May we all keep our hands on deck. The war is not over. This is a long-term war. It will probably take us a year and a half to 2 years living with COVID. And so therefore, we must not lose any stamina. It's a marathon that we are running to deal with COVID. But thank you very much, Premier.